Slides are up. So today we're going to talk a little bit about the process Voices took to arrive at our new 3-year strategic plan, talk about some of the questions we asked ourselves and some of the feedback and information we gathered during the process. And then the bulk of the presentation will actually talk about our new policy goals for the upcoming 3 years. So you can go to the next slide, Megan. So I think most of you are already in the Voices universe, and we're so glad to have you here with us today. And you probably know a lot about Voices already, but we are celebrating our 30th year this year. We were founded in 1994. We recently held a celebration last month. You can see in the photos here some of those pictures to honor our 30 years of advocacy and to talk about our plans for the next 3 years, but really for the long-term future as well. Voices is the only multi-issue, nonpartisan, independent youth policy and advocacy organization in the state. We take that role very seriously. I'm seeing a lot of partners on the presentation today, and we are so grateful to be working with you in this larger ecosystem of child well-being. So I'll tell you a little bit about Voices. You can go to the next slide, Megan. I mentioned we were founded in 1994. And when we were founded, in our articles of incorporation, there is some really powerful language I wanted to share with you today. Really, our founders came together and they looked at child poverty across the state. It was actually at an all-time high in the early 90s. And they really thought, look, children and youth need more of a voice in our state legislature to influence state laws. And they asked themselves, what will it take to make the well-being of children and youth the focus of intense thought, debate, and action by all policy and decision makers, the media, and the public? And that's really what we're still asking ourselves today. We are constantly looking at ways to make the well-being of young people the preeminent topic at the Virginia General Assembly and to keep well-being of children and youth at the top of the minds of all of our power holders, our decision makers, our lawmakers, our representatives. So we still really hold true to that central question. Next slide, Megan, is our updated mission and vision, which we adopted about 2 years ago. We envision a Virginia in which our systems center young people, ensuring their ability to realize their brightest potential is no longer predictable by race, socioeconomic status, or geography. And we do that through our mission. We champion public policies and legislation that achieve positive and equitable outcomes for young people. And the next slide has a little bit about our theory of change. And I think a link is also, there's also a link where you can see our full theory of change. But I want to pull out 3 core areas. And this is really what we do on a day-to-day basis. We call it the 3 C's. We collect data and conduct research. We convene advocates and join them together with decision makers. And we cultivate the voices of young people and their champions. And I think that's really powerful because it's the unique role we play in the ecosystem of child and youth advocacy and well-being. We do not provide individual services, as many of our partners do, but we take a systems level approach, making sure that systems are just, making sure that systems are keeping the well-being of young people front and center, and really helping to create the conditions that allow so many of our partners to provide effective services to children and youth. So I'll tell you a little bit about our process. It was actually a 6-month process. We used consultants who had worked with us before at the consulting firm of Dax Dev Consulting, located in the DC area. We are so grateful for their support. We took 6 months to bring together our board and our staff and to hear from community members and partners. We kicked off with a retreat for board and staff, really homing in on some central questions that we needed to answer about our identity as part of our strategic plan. We also formed a board and staff committee to guide the strategic planning process throughout the whole 6 months. We held multiple staff feedback sessions. We received feedback from community members. And on the next slide, you can see our guiding questions. So we had a lot of questions about our identity as an organization, particularly after so much transformation, both internally and just externally in the world over the last 5 years or so. Obviously, we had the COVID-19 pandemic, which disrupted everyone's ways of working, certainly disrupted public health and the economy. We were grappling with the national racial reckoning in our country and grappling with understanding our particular role in championing racial equity and justice for young people. And so we identify these questions that you see on the slide here today to guide us through the process and to ultimately give us the answers we would need to make our roadmap for the future. And these questions really are about contemplating who we are in a changing policy and advocacy landscape and identifying the tensions in our approach to advocacy during a period of transformational change. So we asked ourselves, how will we maintain our identity as an independent voice for children in an increasingly polarized political landscape? If you follow policy at all, you are familiar with just how polarized things have become. And Voices has always been able to play a nonpartisan and independent role in being a champion for young people. So we wanted to grapple with how to continue that when the world seems so polarized. We also asked ourselves, how will we continue to expand our advocacy to include all young people ages 0 to 25 while we maintain our strong roots in early childhood advocacy? And that question later became, wait, are we really expanding our community of youth up to age 25? And I'll talk about that in more depth as well. We asked ourselves, what will it take to create our unique data and research brand? We asked whether we needed to be expanding our policy work to include additional issue areas. And finally, we asked ourselves, what does it mean for Voices to partner with community members, particularly young people, in our advocacy work? We also conducted community feedback through our strategic planning consultants, and we were so grateful for the feedback we received. It was helpful in understanding our identity and understanding the value we provide in this ecosystem of advocacy. So first, we heard feedback that Voices is seen as a credible entity and that we do add unique value to the advocacy landscape. One community partner stated that Voices was like a third-party advocate that was not connected to any specific interest group, and that's a good thing, right? We are at the General Assembly. We are working in the state legislative landscape, really on behalf of the needs of young people, and not for any other specific interests. We also heard feedback that Voices should really lean into its strengths. We heard that we should lean into engagement, into holding convenings of advocates and service providers and young people and families, that we should lean into our power to build narratives around young people and well-being, and that we should lean into our intergenerational approach. More specifically, we heard a desire for Voices to use more storytelling as a way to promote our advocacy. We heard that our work as a convener and as a facilitator were deeply valued, and that folks wanted even more convening opportunities, particularly in-person opportunities, now that the pandemic has subsided. And we heard that our intergenerational approach was really unique and that we needed to more clearly articulate our approach to working directly with young people in advocacy. We also heard that Voices really needs to be clear about the policy goals and positions we take, and that this is actually vital for maintaining trust in relationships with partners and with young people. We heard from both staff and partners that trust-based relationships with young people must be the foundation of our advocacy. We heard from staff in particular that Voices has typically taken a reactive approach in our advocacy, where we have planned our goals from year to year, where we have responded to emerging issues or funding opportunities without always having a plan for long-term policy change. And we do know that policy change in Virginia can take many years to accomplish. We also realized that being clear about the policy positions we take helps to build relationships, particularly with young people. Because young people need to know how they can rely on Voices in order to champion their well-being. We also heard that it's easier for staff to maintain relationships with partner organizations when our positions are very clear and are clearly communicated. And we also heard from staff, another theme here, that we should lean into our convenings and bring together youth and families with lived expertise. So in considering the guiding questions we identified, and in considering the very generous feedback we received both from our staff and our community partners, Voices realized we needed to be really prioritizing and consolidating our policy work rather than expanding it. This is partly an account to our limited capacity, and partly because we wanted to lean into the areas where really we add unique value to the policy conversation. So I'll talk about some of the shifts we undertook as we started to create our new policy goals. So in terms of consolidation, our staff identified a set of questions to help us to understand what policy issues really need to be our highest priorities and take the most capacity. And they're on your screen here. And this is really part of moving from a more reactive or short-term approach to a long-term approach to policy change. So we asked ourselves, are we the best leader for this work? What is our unique value add? Do we have the current capacity for the work, or is it something we've already promised to do? And does this work further racial justice? And in asking ourselves those questions and going through all of our work, we realized we needed to consolidate some of our policy areas. And so we ended up consolidating our food access work into our economic security work. Now, we don't see those as separate issue areas. We made the hard decision that we will not work on most issues of K-12 education, but will instead focus on resources for school-based mental health programming, which we will talk a little bit about later. And finally, we refined our early care and education work to the areas where we really add unique expertise in the ECCE landscape. Going to the next slide, we also identified some definitions. We call it our language of change. And this is part of being clear about our work and our priorities and why we say the things we say. So we made the decision or really reached the conclusion that our policy work spans the ages of 0 to 25. We need policy interventions really from the prenatal period through young adulthood if we are going to build a Virginia where every young person can thrive. And in reaching that conclusion, we are also taking guidance from the expertise of some of our close partners at the Annie E. Casey Foundation, at the Youth Next Research Center at UVA, and several other researchers who really tell us that adolescence, that period of 14 to 25, is also an important developmental period for the brain, just like that period of 0 to 5 in brain research. During adolescence, the brain is especially open to learning and growing, and this is a critical time when strong support systems can be crucial in a young person's well-being. So rather than focus our work really on the younger age in the spectrum, we are broadening the spectrum. And we are, as you will see in our policy campaigns, working on policies in each particular age subset of that spectrum of 0 to 25. So when we say young people, we mean Virginians between the ages of 0 and 25. We also really worked to define our community. Who is it who receives the benefit of Voices work? And we really decided that we are centering young people with lived expertise as well as their families. These are the young families and, the young people and families who are most impacted by our child serving systems in the state. That is who the work is most impacting. And so those are the perspectives we want to try to center. We also spent quite some time thinking about our approach to advocacy, particularly what it means to be intergenerational and to have youth-adult partnerships in advocacy. And we concluded that intergenerational engagement is one of our strengths, and it's actually one of our most powerful tools, not just for policy change, but for civic engagement in general. You may have seen over the last 4 years or so that Voices has really deepened engagement with young people directly, particularly with teenagers and young adults. We launched our Virginia's Youth in Action program 2 years ago, and that is our flagship youth leadership development program. We've really leaned into cultivating the voices of young people and honoring their agency. And so we wanted to further lean into that and really note that this approach is not an abandonment of our advocacy on behalf of young children and infants. We will continue that work, but rather this is an enhancement of our work that allows us really to center young people with lived expertise and cultivate their voices in the advocacy space. And finally, we realized we do systems change work and we want to lean into that. We are looking at root causes of the disparities on the lines of race and ethnicity and gender and socioeconomic status and geography in our systems. And really our work is aimed at dismantling structural and systemic barriers that stand between young people and opportunity. And I think that really does help us to serve our partners on the ground, that we are creating better conditions for our partners to do great work. We identify trends and we provide support in those efforts as well. So all of that discussion led us to identify 5 big and bold policy goals for the next 3 years. I'm going to talk about those one by one, and talk about a little bit about why we chose those and some of our objectives for the next 3 years. So our first goal is economic security. We envision a Virginia in which every family is financially secure and able to provide a healthy life for their young people. We really understand that economic security is the foundation upon which thriving families are built. Economic resources determine whether our young people have access to food, to adequate and safe housing, to affordable health care, to early care and education opportunities, to educational enrichment, to public transportation. It's economic security that is the driver of so many outcomes for young people and families. And we recognize that typically we measure economic hardship as a lack of financial resources, and you will see some data along those lines. But we also understand that economic hardship can create daily trauma and chronic stress for young people and is a major impediment to health. So we understand that Virginia needs to intentionally remove barriers to youth thriving by providing social support and adequate financial resources for every family. I'll talk a little bit about that on the next slide. So as you can see, Virginia's child poverty rate hovers around 13%, according to census data through the American Community Survey. It has not changed much since the end of the pandemic. And using another measure, the ALICE measure, which stands for asset limited, income constrained, and employed, 35% of families are below that threshold. We envision a Virginia that does a lot better by families and children. So we have our goals for the next 3 years involve quite a bit of tax relief and financial support directly to families. We want to ensure that Virginia prioritizes family economic security in tax relief proposals, including expanding the earned income tax credit and establishing a state level child tax credit, and then taking family size into account for all tax rebates. We want to ensure that Virginia provides expanded income support to families through public benefits programs like TANF and guaranteed basic income pilots. There have been some successful pilot programs for GBI, both in Northern Virginia and in Richmond. And finally, our food access work fits into this goal. We hope to ensure that young people have access to nutritious food through universal school meals and food as medicine programs. And you will see some of that work in the upcoming General Assembly session as we launch a campaign to provide free school breakfast and lunch for every public school student in the state. So our next big goal out of our 5 goals is around the issues of early childhood care and education. We envision a Virginia in which families have access to a variety of affordable, high quality early care and education opportunities. I have young children. I have recently paid quite a bit of money for early care and education for my children. I know how expensive and how just inaccessible it is to so many of our families across the state. And yet it is such an essential component of a thriving childhood. High quality early care and education opportunities allow allow parents to pursue paid work, which is very important to providing economic security for their families. But they also provide children with a strong developmental foundation. Those neurons are all firing in the early childhood brain, and high quality early childhood care and education opportunities facilitate that brain growth. Parents have to pay too much for childcare. We know this. The other flip side of that is that early childhood care professionals make too little. And we really need more state investment into a mixed delivery system of early education and preschool that includes a variety of placements that families can choose from, including home-based setting, private childcare providers, and public schools. We also need to increase compensation for our early educators and provide additional subsidized slots for families who are struggling. So you can see some of our data here, including a recent data point that came out at the beginning of the month. Nearly 10,000 children in Virginia are still on the child care subsidy program waitlist, primarily in the South and Central regions, according to the DOE. So we know this is an urgent crisis. So our policy objectives for the next 3 years include increasing state investment in early childhood care and education by at least $500 million, increasing the allocation of those funds to increase educator compensation. And also, we want to see a diverse array of young people who are experiencing the benefits of ECCE. So we want to make sure that participation in those opportunities is representative of the full racial, socioeconomic and geographical diversity of Virginia. Our next goal is around health equity. In this area, we envision that young people in Virginia have equitable access to the resources they need for a whole lifetime of good health. And we know because research tells us that health is not just the absence of illness. Health is really defined by how much access you have to high quality, affordable, and culturally responsive care. In Virginia, our legacies of poverty and structural racism cause devastating health disparities among young people. And having healthy young people requires us to make sure every child has access to affordable health insurance coverage, a diverse and well-educated healthcare workforce, and opportunities for healthcare wherever they live. So the next slide has some more information about this. So recent data as of last month indicate that more than 130,000 children in Virginia have lost their Medicaid coverage during the Medicaid unwinding period, and almost half of those were closed for procedural reasons. So we know we have a lot of work to do to ensure that every Medicaid eligible child is able to enroll in and use their Medicaid benefits. We also know that nearly 90,000 children are in Virginia are uninsured simply because of their immigration status, and we want to change that as well. So our policy objectives over the next 3 years include ensuring that every child and their family in the Commonwealth have health insurance coverage, that our family healthcare workforce is diverse, educated, and informed on youth well-being, and that all families have access to high-quality healthcare that is tailored to their needs, including language access services, access to gender-affirming care, access to a variety of Medicaid services, and access to perinatal care. Goal revolves around youth mental health, and we intentionally kind of took this out and made it its own goal because it is such an urgent priority. We did not want it to be lumped into the rest of the healthcare goals, although we of course know that mental health is health. And we also pulled this out to become its own goal because this is what we're hearing about from young people. When we talk to young advocates across Virginia, it is clear that they are demanding a transformation of Virginia's mental health system. They are telling us that families need access to a continuum of mental health services wherever they need it and whenever they need it. We need crisis care, but we also need preventive care. Currently in Virginia, access to mental health care depends on where you live, how old you are, and how much money you make. And we want to see a Virginia with an improved system of clinical care to address the unique mental health needs of young people, but also a recognition that mental well-being goes beyond clinical care. That preventative factors like having economic security, like having welcoming school environments and youth development opportunities are also important in stopping the youth mental health crisis. So I mentioned earlier that Voices had made the tough decision that we would not be doing broad K-12 policy, at least not for the next 3 years, but that we are very interested in school-based mental health programming as one potential solution to Virginia's mental health crisis. And we are really leaning into that goal, and you will see that in our legislative agenda for 2025. So for the next 3 years, we are working to ensure that our public schools in Virginia integrate a continuum of high quality school-based mental health care services. We do have a report we've recently released on that, and it is linked in the chat, so you can learn more about those initiatives. We also understand that Medicaid reimbursement rates are crucial for providers who want to provide Medicaid funded services, and that we need to increase those to ensure that we have enough providers who are offering a high quality continuum of child and adolescent mental health care. And finally, we need to do some narrative change around youth mental health. I think I've mentioned a youth mental health crisis 2 or 3 times already. And it is true that statistically, Virginia ranks pretty low in the country in terms of youth access to mental health care. But there's also so much good about our young people, so much good about their resilience and their hopes and dreams for the future. And we want to make sure that we are talking about youth mental health in an asset-based way and not just a deficit-based way. Our fifth and final priority in our policy landscape is to transform the child welfare system. And we envision a state in which our child welfare system puts families first by offering support and preventing separation. The child welfare system was originally created to address family disruptions and to protect young people and their well-being. But the modern child welfare system often fails to provide young people and families with the tools they need for stability and success. And too often our child welfare system separates families and particularly separates families, creating high levels of racial disparities in outcomes in the system. So we want to see a child welfare system that prioritizes family preservation, keeping families together, and prioritizes actually preventing foster care through providing economic and social support for families who are struggling and providing support through kinship care arrangements. So our goals for the next 3 years are to champion a statewide fully funded kinship care program, including a kinship division at the Virginia Department of Social Services. We made great strides on this goal in this past legislative session, along with many, many partners who have been working toward this goal over the last decade. Governor Youngkin did sign a new kinship care law in July. And so we will be focusing in the next few years on implementation of that law and how the local departments of social services will be moving to a kin-first approach to child welfare. We also know that children who are aging out of foster care need to have transition services and need to have access to higher education opportunities to make that transition smooth and successful. We are great believers in the Great Expectations program through the Virginia Community College system, and we want to make sure that young people aging out of foster care have expanded access to that program. We want to see it put into high priority high schools and all public 4-year universities across the state. And finally, I mentioned that we want to prevent family separation whenever possible. And we know that part of the way to get there is to ensure that parents in the child welfare system have adequate legal representation. And so we want to ensure that there is a regional pilot program launched for parent advocacy and legal rep statewide. So these are lofty goals. We have a lot of work to do over the next 3 years. And we have also had to ask ourselves, how are we going to operationalize this at Voices? And how do we need to enhance and expand our current capacity to help us reach all of these lofty goals? So I've put a few of our conclusions on the slide here. First, we know that we need to expand and enhance our capacity for collecting data and conducting research. These are two activities our theory of change is based on. We know that we are seen as credible, seen as credible because we rely on evidence to take our policy positions, and we're going to need to invest additional resources into expanding our data and research capacity. We also knew that we wanted to lean into our communications capacity and enhance our ability to conduct storytelling as a version of advocacy. We heard a lot in our feedback that our communications are important, that it is particularly important that we are clear about our policy positions, and that we add great value when we develop asset-based framings of policy issues. So we will be leaning into our communications capacity as well. We also concluded that we need to start looking at expanding our presence statewide. Voices is a statewide organization. We do systems change at the level of state legislation, but we are based in Richmond, and we have strong relationships in certain parts of the state, including Northern Virginia, and of course here in Central Virginia. But we really need to prioritize relationship building and engagement in other parts of the state, including Hampton Roads and Southwest Virginia. We concluded that we need to lead into our intergenerational engagement approach and develop further expertise in those areas, which we are doing as well. And finally, build an organizational structure that makes Voices an employer of choice. We have made great progress on our journey around internal equity and racial justice, but it is a journey, and we need to continue to work on that. We are hoping to build a more intentional organizational structure and culture, including more formal salary bands, increasing our salaries so they are more competitive, and creating more professional advancement opportunities for staff. So that is all the remarks I have for today. I'm so grateful you joined us to hear about our next 3 years, and I'd be happy to answer any questions.
Great, thanks so much, Rachel. If you have questions, feel free to either come off of mute or to drop them in the chat. We'd love to discuss with you any of your questions or comments you may have. Do you have any questions, comments? Let's see. Okay. One here from Karen. What are you doing internally around aligning the organization with racial equity other than adjusting salaries? I'd love for you to say more about that. Thanks, Karen.
And I'm not sure that was Karen. I think it's someone on Karen's Zoom. Maybe.
Oh, okay.
maybe Janice. Hi, Janice and or Karen.
Oh, it's Janice. Yes,
okay.
Thank you.
Great. Yeah, thanks, Janice. It's definitely more than just salaries, although salaries is one of the more urgent issues that we identified. It's also understanding professional development opportunities, looking at hiring practices, looking at the ways we create job postings and create diverse recruitment opportunities. looking at power sharing in the organization, the balance of power, structure, all of that. We have done a lot of that work. We've really been on a journey over these last 4 or 5 years. And the salaries is standing out as one of the next things we need to tackle to make more equitable.
Thanks for that question. Anyone else? Questions? Again, feel free to drop it in the chat or to come off mute.